Hello, everyone, and welcome. This is Mommy and Me on assignment. I am your host, Tanisha Carroll, and today we are continuing our conversation with our very special guest, Miss Kimberly Yhap. Kimberly, we're so grateful to have you. I want to introduce her just quickly again. That she is a registered nurse of over 10 years. She is, I'm sorry, she's a registered nurse and a certified professional speaker, author, and menstrual and hormonal wellness coach and fertility care practitioner. And she has over 10 years of experience helping women who are struggling with irregular periods, painful cycles, PMS, and all things related to the menstrual cycle. And she has created the Growing Girls event and menstrual cycle tracker for moms and tween daughters to discuss what is happening with their bodies. Uh, we are grateful to have Kimberly with us today to share a little bit more about the menstrual cycle and how we as moms can help our tween daughters through to understand the menstrual cycle and to go deeper into how to have a healthy menstrual cycle. And today, so welcome, Kimberly. Thank you so much for being here.
Thank you. Thank you so much, Coach Tashana, for inviting me to It's Mommy and Me. I am so grateful to be here. I'm so grateful to be here to really, you know what? Guess what? We got to sharpen iron. Iron sharpens iron. And we need to be able to help our moms understand this on information. We need empowered girls for this
Yeah,
generation. That's
for
going to
sure.
solve a lot of our problems if we have empowered girls. And we got to start young. And I'm so glad about your platform, the fact that you're addressing tweens. And I'm a mom of a tween, so I'm so glad for that as well. Because this is where we need to start. So thank you for having me.
Yes, ma'am. So last time we talked about what is the menstrual cycle and then things how moms can start the conversation, the initial conversation about the menstrual cycle and the flow, what we call the flow or the period. And so if you haven't seen that video, please go back to the previous day, and you need to look at it and check it out so you can get that information. Today, we are going to focus on the truth about and the myth concerning the menstrual cycle. So tell us, what are a few things that people say about the menstrual cycle, but it's really not true?
Okay, great. Great question. Great question. So we're going to be looking at the truths and the myths, or the myths and the truths about menstrual cycle. So I got a couple here for you, and we get started. One of the myths that is floating around about the menstrual cycle is that a woman only needs to ovulate or have a period when she wants to have a baby. Now,
Mm,
that's a myth. And unfortunately, if you were to Google that information, you will find it in print saying that no, you don't need a period. You only need a period when you want to have a baby. And that's a myth. And if you were there last week, you would have understood that ovulation is key for not only having a baby, but ovulation is key for every aspect of our bodies. Ovulation also, the healthy cycle, or the fact that we're ovulating, sorry, is a vital sign of health. Just like how we have blood pressures that tells us our pressure is too high or too low, or we have our temperature that would tell us if we have a fever or not, or if we're breathing too fast. Our menstrual cycle and ovulation, to be more precise, gives us an idea of how we're doing in our bodies. So it's very important, one, that a girl understands that she needs to ovulate for her bone health, for her heart health, for her moods, for her skin. Because if we don't ovulate, it will impact us negatively. It will impact our bodies negatively. I've had women, and I know we talk moms here, I've had women who are, they're in this reproductive years, and they're talking, they're talking a lot about vaginal dryness, right? I know, and guess what? If our body is doing what it's supposed to do, we ain't got no reason to be dry in our
Mm,
reproductive years, right? So remember we just talked about ovulation, right? So here, no wonder KY jelly got so much sales, because if we're stopping ovulation, we're going to be stopping the way our body works, right? And
mm,
so dry skin. So we have lots of dry skin issues, and we go and yes, we put on Jergens or whatever the case may be, but nobody looks back to think, I wonder how my body is working. Because if I have a
mm.
healthy cycle, things should be doing fine. So just a little tip down there about
Okay.
one of the first myths there.
Yes, that's good. I love that. And to understand that if you're having some external issues or things that you're seeing happening in your body, that your cycle is a it's a teacher. It should show you. So if your cycle is healthy, then there are some external things that you're not dealing with.
That's
You
right.
know, so I mean, your heart health, your mood, your skin. I'd never heard that before. Your skin, the dryness, so that there's an internal dryness and an external dryness.
Awareness,
And
exactly.
so to deal with that, okay, this is good. This is really good. Where you
Okay.
teaching us, Kimberly?
Okay. So the next myth that is there is that um, every woman has cycle is just 28 days, right? Now, that would be ideal, but unfortunately, only about, they say about 13% of women may actually experience cycles that may be around 28 days. Or even if they ovulate on day 14, we'll probably talk about that one a little bit later. But for women, we need to understand that, there are there are two extremes. There are extremes at puberty, where the girl may start to see her period, and it may start off being a longer period, about 4 to 5 days or so. She may see, that may be a little bit on the regular side. And then the other extreme in perimenopause, we have the point where, okay, so in the girl, the little eggs are so young, they're, just trying to feel their way, and they're getting there, you know. But on the other extreme, oh God, these girls have been around so long. I mean, like they're now chugging. I mean, it's like they're taking a longer time to get there. And so here we have the two extremes where we may have some cycle irregularity, and it's important to know them. One of the reasons why it's important to know them, because if you are, or if a girl or a young woman is in her, let's just say early 20s, and she's having a cycle that's behaving like she's in her 40s, that's a problem, right? And
Mhm.
so one of the things we can find cycles, regular cycles can go between, let's just say 25 to 31 days, maybe a regular cycle. Less than that, it's a shorter cycle. And that comes with some facts that we need to know as women as well. Then we may have cycles that are very long, longer than 4 to 5 days. Listen, don't sit around, even yourself or your daughters, with cycles that are 2 months, 3 months, and you're not seeing a
Mm,
period. Don't sit around with that. You need to get proactive. And unfortunately, for some women, it's not prioritized. I've had girls tell me that, and some nurses who told me that, the doctor said she's not going to address it because I'm not ready to have a baby. What? It's not a healthy cycle. Something is going on beneath the scenes. And so, yes, in as much as we would love to see 28-day cycles, some women do not have 28-day cycles. But that's the goal. That may be the goal. There may be lots of things that can be pushing your cycles out of those ranges, right? Out of the normal range. And so, yep, that's a myth as well. Okay, so
okay.
you need to know what is your cycle. And on
Yeah.
that score, I just want to talk about the apps, a little bit about the cycle apps, because I know that's the trend. It's easier way. I know my daughter said to me when I was telling her, okay, but you have to do the book, Mommy, my friends use the app. And I'm like, but we're doing something that's greater that the app doesn't, anyway. So the thing about it is that I'm just trying to get her on board to understand that mommy understands a lot when she can see it. When they have the app, you can't see anything on the app. But one of the beautiful things I like about the book that I've created that you've alluded to before the last session is that it gives me one whole year record of how your cycle works throughout the year. So you turn up to your doctor, your daughter's doctor, with this book, and they not only ask you about your last menstrual period, say, Doc, listen, when she started, she had 2 days of 2 days of this, 2 days of that. Guess what? It gives you so much detail. So it's a myth because, and that's important that you understand what your cycle is, what your cycle length is.
That's good. That's important because I have always been a 28, 29 day girl, like clockwork. But like you say, my daughter, it's new, so sometimes it's a little bit longer. And so we don't see that flow on them every month yet.
That's right.
It may be every other month, and then some of the flow is a little bit longer. So it might be just 2 days, and then the next time it's like 6 days. One time it's like 12 days. And I was like, oh, that made me nervous. But I'm like, okay, I'm gonna give it some time because it hasn't been a full 12 months yet to,
That's right.
Just get her regulated. But this is such good information. Um, as we're talking about myths, of course, we have to be careful that we don't just do things just because it's what mama and grandmama told us. And because sometimes there's an old saying that when you know better, you do better.
That's right.
And so as we are educated, our mothers and grandmothers, they didn't know.
That's right.
They didn't have the understanding. And to your point, when it comes to the babies, that's all we really knew about the menstrual cycle was this is for babies. This is to have children. And so that's all we focus on. And so but to understand that this is about our health as women, that's so important to empower our girls to take responsibility for their health at their young age. And I love that because I do believe it is empowering. It helps us to be able to speak on our own behalf. And when we go to the doctor, we can say, hey, this is what's happening. I know that this is not right, and I need you to address it. And if they won't, then we know we need a new doctor.
Yeah. I love that note that you just ended on. The fact that it is empowering for us to know what our bodies are saying. And with that, I'm going to jump to this next myth. I kind of hummed how, but we jump into that myth. And the myth was that, this white stuff that I'm seeing every month must be an infection, must mean that I have an infection. And so for those of us who were not tutored on the different changes that we may see externally in our bodies. So for those of us who did not know that a menstrual cycle consists of a red flow, and it also consists of a white flow, would have seen this particular presence either on our underwear or when we wipe. We didn't know what it was for, but we know it showed up. And for some of us, we would have thought that this must be that I'm having a yeast infection or something of the sort. I have had the experience to quite a number of years ago. I was at a medical conference or medical outreach, and a young 16-year-old girl came to the clinic and she said, I am seeing this white stuff every month, and I don't know if it's an infection. Well, listen, to be honest, the girl was more astute than me because I didn't even realize it. She was 16 and I was a nurse. And my question to her was, so are you having intercourse? Because the first thing you're thinking of is that, and I was like, wow, I wish I could go back then and educate her. But one of the things we want you to know, yes, you need to be observant about what you're seeing. And you also need to know that there's a difference in what you're seeing. So,
Yeah.
yes, if there is a disinfection, it shows up differently. And you need to be aware of that. But one of the things I really want us to know is what is normal. What are you normally seeing cyclically? So every month
Mhm.
I'm seeing this stuff that is kind of white. And now one of the things in the courses that I teach, we talk about, just finger testing it. And sometimes it can be stretchy. Sometimes it can look like egg white. Well, I wouldn't tell you what I thought it was, even though I was a nurse, or where I thought it was coming from. I tell you. And I've had another nurse told me the same thing too. I thought it was from the back, because we were taught that, there is mucus in the back. Never really,
Yeah.
nobody told us that. Guess what? Guess what? This is coming from the most special
Mhm.
part of a woman. And
Mhm.
so just being able to be aware of what is normal, then you'll be able to know when it's not normal. Because if it normally shows up at a particular time in your period, in your cycle, and you know that it's approaching ovulation, it's going to be key. And Tashana, the empowering part is going to be important, because I remember having a friend go to the doctor, and she had a pap smear or an examination. And the doctor said to her, "Oh, I'm seeing some white stuff down there." And she treated her for an infection. And I said to her, "But what part of your cycle are you in?" Right? That's where we need to be empowered, because you needed to be able to tell the doctor, "Oh, no, 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 no. I'm approaching my ovulation right now. And this
Mhm.
only just came on." That's where the empowering comes from. That's where you are empowered with that information about your body, so that you can probably avoid needless medication that you just
Yes.
don't need. So that's important. So our girls need to understand, no, it may not necessarily be an infection. There was this woman, I'll probably just tell the story quickly. There was this woman who was infertile and, wasn't having a baby. She went to one doctor. She was just about to go to a fertility clinic when she was told to go to have a second opinion with someone else. The doctor asked her an important question. She says, "Are you having any cervical fluid?" She said, "What's that?" She said, "Well, she explained to her. She says, 'Oh, yeah, I see it every month, but I think it's an infection. So I don't really have, intercourse with my husband around that time.'" So the doctor said, "Well, you know what? That's actually your cervical fluid," and explained to her in 2 months she was pregnant. Right. So
Wow.
here's empowerment. Here is empowerment for moms, right? Okay.
Right. I love it. I love it. This is such valuable information. And so moms, we gotta help our daughters not to ignore what's happening in their cycle, in their vaginal area. We gotta talk about it. We gotta talk about it. And we can't just say, don't be messing with these boys. We got to talk about the health of it all, because it's not just infection. Because if you think it's infection all the time, then you're also putting unnecessary medication into your body, and you don't have to do that. And so, not knowing this woman, not knowing that that was the perfect time to be with.
Yeah.
And so, ladies, listen, I hope that these myths and the truth has helped you. Again, this is Mommy and Me. This is Tanisha Carroll. And listen, I want Kimberly to talk about her book really quickly, and so that you can get it. We're definitely going to put the links in the video so that you can grab this book and support her base, because this information is invaluable, and you are getting this information for free. Hello. And so
Exactly.
you need to get the book and sew back into her. So tell us about your book, Kimberly.
Okay, so the book is "What's Happening Inside My Body: The Growing Girls Period Tracker Tips and Journal." It's a 3-year journal. And one of the things I like about the book is that it's a medical reference for you and your daughter. It's a medical record. You can go back at any time. And I like when Coach Tashana was talking about what she saw as a mom with her daughter who is now starting her cycles. Yes, you see those days that going to 14 days, and I'm like, what? I remember once my daughter was able to say, Mom, I'm seeing such and such, I'm seeing these days of just brown discharge, brown bleeding. And then it stopped. And then she says, Oh, Mom, my period has now come. 3 days later, she was able to know the difference between what a normal flow may look like and what's not a normal flow. And so great information. You can pick it up on Amazon if you're outside of Canada. But if you're inside of Canada, kimberlyyhap.com. If you need more information from me, you can contact me on kimberlyyhap.com.
Awesome, awesome. Well, thank you so much, Kimberly, for sharing with us. We're looking forward to further conversations. And ladies, again, this is Mommy and Me on assignment, and we are helping you to talk with your tween about the menstrual cycle. And I hope that this is helping you. Make sure you reach out to Kimberly. We will see you next time. It's Tanysha Carroll. I'll see you again soon. Bye.